The two-day national conclave Cohort Connect 2025 on longitudinal cohort studies began Thursday at the CSIR Institute of Minerals and Materials Technology in Bhubaneswar. The event was attended by Union Minister of Science and Technology and Earth Sciences Dr. Jitendra Singh as the chief guest. Also present were CSIR-IMMT Director Ramanuj Narayan, Principal Investigator of the CSIR Health Cohort Knowledgebase, Shantanu Sengupta, Co-Principal Investigator Viren Sardana, and several doctors from across India. The Phenome India CSIR Health Cohort Knowledgebase program aims to establish the Bharat Biobank, a national-level resource to promote early detection, prevention, and development of India-specific health parameters. It follows individuals over time to study disease progress and risk factors unique to India's population. Dr. Jitendra Singh said the initiative focuses on 4 key health determinants: biological, environmental, genetic, and lifestyle factors, each influenced by India's vast diversity in food habits, environment, and genetic structure. He mentioned that metabolic disorders in India often appears as clusters and cannot be studied separately from communicable and non-communicable diseases. He emphasized that with nearly 70% of India's population below 40, prevention and early intervention must be a top priority. His vision was clear: Indian treatment for Indian patient.
At the outset, I have to compliment Dr. Ramanujam, his entire team, the CSIR family, for having planned and organized and conceived this beautiful event, Phenome India Conclave, a cohort study, and that too on an eventful day, on the eve of the World Diabetes Day, which is being observed across the world tomorrow, on the 14th of November. And this is a study which is going to evaluate some of the basic determinants of health in the current age and times, namely the biological factors, the environmental factors, the genetic factors, the life disease factors, which also determine the vulnerability or susceptibility of individuals for a disease. And that we are going through an era of metabolic disorders like type 2 diabetes mellitus, coronary artery disease, dyslipidemias, etc., etc. And our new initiation would be in the area of genes, genetic regimes for prevention and genetic therapies for cure. You will be glad to know the same ministry, through the Department of Biotechnology, has come out with the first ever successful genetic therapy trial in hemophilia, which is a bleeding disorder caused as a result of the deficiency of clotting factor 8-9. And likewise, through this study, we are going to learn or try to validate and evaluate how the Indian phenotype is different, because it's been known for several decades that Indian phenotype is different. For example, Indians are more prone to central obesity, unlike the Westerners, who may be obese overall, but may not have visceral fats so much as even a lean Indian had. But we did not have the means to validate it, and now not only we will validate it, we will also find out the preventive strategies and therapeutic strategies, and maybe tomorrow we'll have an age of personalized prescriptions. For example, you have 4 persons with the same disease, each person may require a different prescription or may be able to procure a different prescription depending on his lifestyle, his genetic makeup, his environmental conditions.
Director Ramanuj Narayan said the project marks a shift from treatment to prediction and prevention. He shared the data from one participant helped detect an unnoticed health issue, enabling timely care. As Phase 2 concludes, Narayan said the initiative aims to build a Swasth Bharat through personalized data-driven healthcare.
If India is looking for the Viksit Bharat, in that place, it is a pan-CSIR program where we are taking sample of 10,000 people across the country. Right now, it is limited to CSIR staff and their family, and the most importantly, it is as per their willingness, because somebody do not want to share their test results. When you are going to a doctor, what is this cohort is, when you are going to a doctor, they will write you prescription that you have to do this test, that test and all. So in this cohort study, starting from blood sugar test to heart test to lung test to a stool that is called gut microbiome test and this strength test. So all set of parameters, and this place doctor plus our coordinator from CSIR IGIV is the prime lab led by Dr. Saubik Mathi, Shantanu Sen Gupta and Dr. Sardana. Sardana himself is a MBBS. So in this case, what will happen? What two series it has been done. 3 times you have to take sample of these tests, same people. That what is happening. One time you cannot correlate. So 3 years is the minimum requirement. So we are doing already completed phase 2. Today is the completion, celebration, the study interactions with this. And what it will give, today you have seen doctors from all across the country.
uh, in India, despite being independent for almost 80 years, we do not have our own standards. We do not have our real values of, say, cholesterol or anything. These all values are from Western population. We also do not have any marker for disease. So, whether a person is more prone to getting cardiovascular disease or whether a person could in future get diabetes, these all can be predicted by equations using certain parameters. And in Western world, that is there. For example, risk of cardiac disease in 10 years. There are several studies and each country has their own standards. But the best equation that we use from the West can only tell 60% correctly in our case. So it is like a toss of a coin, right? So there is nothing, really need to create our own. So in that respect, CSIR started this Phenome India study where a lot of, all CSIR laboratory staff and all, we have collected 10,000 samples and we will follow these people up over multiple years. So for example, if today somebody is normal, don't have diabetes, 5 years later he got diabetes. So now we'll know that in the 5 years, what are the things that changed which led to his getting diabetes. So that becomes a equation for those parameters we take and create equation for predicting people to get diabetes. Similar for other diseases. You heard a talk about chronic kidney disease. Chronic kidney disease is similarly, there are the equations don't fit in our country. So we need to create our own data. So when we started this, we thought that, for us 10,000 sample in a country of 1.4 billion is just very meager. So why don't there are a lot of these kind of efforts going on in several places like in Chennai, in Kalyani, in Delhi, in Bangalore, in Mysore. Lot of places have these kind of small cohorts. Why don't we see can we merge these data? Can we harmonize this data? Right? Then what will happen is we'll get the number of people will become more. So statistically, it will give us much more better.
Today, there was a very important program organized here where our SNT minister has participated. This program is basically called Cohort Program. After the COVID pandemic, there was a research orientation to understand how it has affected the people of whole CSIR community. So there was an in-house project funded by CSIR where they are understanding how the COVID has influenced the health parameter, like how it has affected the lungs, how it has affected the liver, how it has affected the heart, what are the vital parameters are affected. All the CSIR employees are giving the bloods, and there are you can say a separate kind of a severe kind of a thing, and people are working as a patient, and you can say they are the test sample. So based on these result, the data set will be generated, and it will be of huge impact because we will be dig out how the age group, different age group people are there, women are there, and people, employee of the CSIR, they are really contributing directly to understanding how the COVID has really affected the masses, and this result probably will give a very important picture about the health issue related.
Stay tuned to Orissapost Live to stay updated.